say, from the DBT lens, DBTers see eating disorder. I'm talking in generalities, but many DBTers historically have seen eating disorders as part of emotion dysregulation. And if you just treat the emotion dysregulation, the eating disorder itself will also go away. That's not accurate. Eating disorders are specific neurometabolic illnesses. So yeah, they're related to emotion regulation, and they have very specific neurometabolic genetic underpinnings that you need to be addressing.
Can you elaborate on that in terms of like a layman understanding the neurobiological? What does that mean?
Yeah. I love this stuff. This is what makes me love this work. So what I mean by neurometabolic is more recent research evidence demonstrating things like people that we know about anorexia right now. I suspect we will see more, but right now I can only speak to the published literature. We know that for a large number of people with anorexia nervosa, there are genetic abnormalities on the chromosomes related to metabolism. What does your metabolism do?
Regulates your glucose?
It's energy, right? It's the energy system.
Yeah.
It's your energy system, right? So it actually is a very comprehensive system that regulates intake, energy expenditure, how food is digested, weight regulation, certain sensory issues, hunger and fullness cues. Now think about this. You've got someone in your office and you think they might have, I'm just using anorexia as an example. This could be across other eating. Immediately, once I know that or I suspect that, I'd want that person to get properly assessed. Like, so if I'm not capable of assessing that, that's okay. But I'd rather say to my client, I'm kind of worried. Could we bring in someone who could, because it's like finding out that your client is, using cocaine and you're like, well, I'm not really a substance use person. I'd be like, what? So I think that you have to lean into it and make sure you understand what's really going on. Because if you have, let's say there's anorexia in this example, how fascinating is it to think, and this is just one of many neurometabolic markers. You've got someone sitting across from you whose genetic makeup makes it so that eating and regulating weight is actually difficult. If you try to treat that by applying DBT skills and strategies, that might help, but you also have to understand what it means to have a different metabolic system. So I'm going to go back to Roger for just a second. When you talked about, our collective dissatisfaction with certain treatments, one of the things that I am passionate about is that standard eating disorder treatments I don't think adequately appreciate what it means to walk into, let's say, a day treatment program when my body is going to metabolize food differently. We've always been like, oh, that's your eating disorder. You just got to push past it, right? And I'm like, push past it. Your metabolism is working differently. This piece has actually shifted how we think we should feed people. So traditionally in eating disorders, it doesn't matter. You just eat this way, right?
Oh, I'm so glad you're going here.
Okay.
Because it's almost impossible to find someone who's willing to have this discussion. All right, so you're bringing up things that we've talked about on this podcast previously. We actually had Dr. Christopher Palmer on this podcast, who is talking about the role of metabolic illness, brain energy, the book Brain Energy. And I've been refeeding anorexics for 12, 13, 15 years at this point. And I've seen the standard struggles. I see what happens when someone becomes hyper metabolic, and I see people who are on specific diets where we're unable to restore weight, like vegan or vegetarian. And then I see how shitty our food source is. I see like the standard crap of processed food that are delivered to our country. And then there's a lot of professionals who say, all food is good food, right? And I don't personally believe that. So if you If you believe that there's an opening here, that we have to find the right foods for someone who may be sick, metabolically ill, vulnerable to eating disorders, what do you think those foods are?
Jeez, these are huge questions. I think that I try to so there's a difference between talking about food in the general population versus people that struggle with eating disorders. So I'm not trying to, what I am going to talk about is I'm thinking about my clients, right? I'm thinking about, so on one hand, I think that the research on neurometabolic underpinnings, which also includes sensory issues. Some people have oral sensitivities. There's all textural issues. There's so much that goes on in terms of what it means to have an eating disorder. I actually think it would be more helpful for people if we helped feed them in ways that might actually be more in line with their neurometabolic underpinning. So an example of that would be there's a publication, Cindy Bulick, Nancy Zucker, talking about, feeding people instead of look, everybody has to eat this way. This is what it looks like. Why not feed them in an anti-inflammatory manner? Because that's actually in line with the sensory neurometabolic, dysregulation, right? As opposed to everybody eats the same way. And I think that's one piece. I don't like to get into discussions about good food, bad food. Like someone with an eating disorder, that can be a dangerous area to get into. I'm more interested in how can you feed your body? How can you feed yourself in a way that you can have a life worth living?
So instead of putting things in categories of good food or bad food,
Yeah.
and we understood nutritional deficiencies,
Mm-hmm.
if we understood how the brain requires certain foods for energy, especially like maybe healthy fats,
Yeah.
and that this could actually improve recovery quicker and ease some of the suffering that takes place during weight restoration, that then we're taking advancements in this field, because now we're integrating nutritional science, science on metabolic health, on neuroscience, and we're implementing it in a way that is going to allow someone to heal faster, quicker. Now, the problem with anorexia, and I'm sure this is something you experience, is that once you become so nutritionally deprived, your brain becomes starved,
Yes.
then your response to food is different than the average
That's right.
person, right? And there's probably an evolutionary reason for that,
Absolutely.
right?
What is that response to the food?
I was going to get to this because Christopher Fairbairn was conceptualizing eating disorders as an over-evaluation of shape and weight. And I didn't agree. It's not what I was seeing in clinical practice, because so many people involuntarily became anorexic.
Okay.
Right. And I'm sure you've seen this, like someone.
Yeah, I don't agree with that.
It's a trauma response, lose their appetite, then they become anorexic. One client had their some teeth extracted and had a dental emergency, which led to they couldn't eat for a couple weeks.
I remember
no history of an eating disorder.
You warned me at one point when I was training for a marathon. I lost like 18 pounds and I was super skinny. And you said, hey, be careful.
Yeah.
Just because it could
be careful, because if you have the genetic, so we often say genes load the gun, the environment pulls the trigger. So you may not have intentionally, like nobody says, oh, I'm going to have bulimia. No, nobody says, oh, I'm going to have ARFID or anorexia. It's it's that there's a huge genetic push. And so for some people, there's enough protective factors and it never develops. Other people, like you start running for a marathon and all of a sudden that your biology responds to that deprivation, weight loss. It just, Cindy Bulick, I love her work. She talks about restriction and anorexia, and she says restriction is experienced differently for people that have this biology, which is that it is soothing. So for most of us, when we don't eat, it's not comfortable. We get hangry, we're upset, we don't like it. It's we want to know where the food is, right? People that are genetically predisposed to having anorexia, that deprivation is experienced as soothing. And she describes it as like an anxiolytic. And she says it soothes an unsettled biology.
Mm. And we see this in some of the ketogenic diet research,
Oh,
where
yeah.
when someone goes into ketosis, there's like a focus, a decrease in anxiety,
Almost feel caffeinated.
improved
Yeah.
mood, and of course, that's not everybody. Some people get really sick. They need to eat food constantly. It probably has something to do with their metabolic system. But I talked about this on the podcast. I'm kind of crazy in a lot of ways. I deliberately calorie restricted for a period of time to know what my clients were feeling because I was treating anorexia. So I did it. I deliberately calorie restricted, lost a lot of body fat. And then it was hard for me to put it back on for two reasons. One, I started seeing food differently. I don't really need that. I started to see my body differently. You're not supposed to have much body fat at all. And I felt like there was a control mechanism over it, right? Oh, like I can live better by restricting this, right? Like it got into my head. If I didn't know better, right? If I
It still
wasn't,
gets in your head a little bit.
if I wasn't educated on it, I wouldn't have restored my weight because my energy was down. Other things, were affected by it, but I could at least get into the mind space, the brain space of somebody who was severely, calorically
And how
deprived.
did the environment respond to your weight loss?
Well, my wife just got pissed at me. She knew what I was doing,
Yeah.
and I've experimented with different things in the past. She just got angry with me for doing it. I rationalized it, why I was doing it, and I want to understand what my clients are going through, and I want to see how my body reacts. There was a lot of reasons that I was doing it, but once you get to a certain place when you've lost the weight, I was weighing myself every day, multiple times, like
You are
checking the weight. You become obsessive with it.
this is that Ansel Keys study of the 1950s, right? The sort of which I always highlight to my clients. I'm like, listen, Ansel Keys did semi-starvation in this group of men, right? Do you know what the semi-starvation caloric amount was? Do you remember that? It was 1,560 calories. The average recommended healthy diet from all the people on the internet is like, you should be having 12 or 13. I'm like, they called semi-starvation 1,600 calories a day for these guys. And they showed you are describing what they experience. So this is what's important, is that starvation is starvation is starvation. And it doesn't matter what your body actual weight is. This is one of the controversies, right? It doesn't matter if your BMI is 15 or 24. If you're in starvation mode, you're going to have the same experience.